Tusemi kuwa ni wauguzi kwa sababu jambo hili linahusisha kila mtu, hadi yule ambaye anafanya usafi katika hospitali hii. Kwa hivyo si wauguzi tu ambao wanalalama, ni kila mtu ambaye anahusikana na kuhudumia mgonjwa katika hospitali hii. Kwa hivyo si vile ambavyo imesambaa kwa mitandao kuwa wauguzi wamegoma. Wauguzi hawajagoma, ila wahudumu wa afya, na si mgomo hasa. Wahudumu wa afya wamesimama hapa ili kuitisha vifaa ambavyo wanastahili kuvitumia ili kujikinga au kuchukua ile tahadhari, ikilingana kwamba sasa hii ndio hospitali ambayo imewekwa katikati ya kuhudumia wagonjwa ambao huenda wakawa na virusi hivyo ama wamepatikana na virusi hivyo vya corona. Kwa hivyo yale mambo ambayo tumekuja hapa kuitisha tu ni mawili tu, hakuna mambo mengine. Sisi kama wahudumu wa afya tuliapa kuhudumia mtu yeyote kulingana na kadri ya uwezo wetu, lakini vile vile ikumbukwe kuwa huwezi kumhudumia mtu ikiwa wewe mwenyewe haujapatiwa ile kinga ama usalama wako katika mazingira yako ya kazi. Kwa hivyo yale ambayo tunaomba kwa leo ni kuwa tupatiwe vifaa vya kazi.
It's as simple as that, tupatiwe vifaa vya kazi. Let's join on the conversation right there. Seth Panyako, when we hear medics actually questioning or raising this particular point that the protective gear is actually lacking, yet these are the individuals who are set to be on the front line. Is it a case of weak defense? And as you answer that, kindly take us through what exactly is protective gear? Because we've seen masks, we've seen so much, and there's also misinformation rather. Who exactly needs masks? Is it members of the public as well?
As a union, our position is that we do not massage anyone charged with the responsibility of protecting the public and healthcare workers. And that is why we are strongly saying that at the national level, the president has done what he ought to do as the president of the Republic of Kenya. But the technical people charged with the responsibility of ensuring that what is done at the national level comes down to the ground to ensure that health workers are protected and the members of the public are protected have failed miserably. As we are talking today, Mbakadhi is a hospital that is now charged with the responsibility of having an isolation wing. Everybody in Kenya knows that now everybody in Mbakadhi is aware of what's supposed to be done. This is Mbakadhi health workers who have no masks for protection. They don't have gowns. They don't have, even you go to the hospital, they don't have even sterilizers. So what we are saying is that in terms of protecting the health workers from themselves infecting each other and the patients infecting them, as well as the patients infecting other patients, in all our public health facilities across the counties is nil. We are hearing many counties saying that we have isolation place, we have this ward, we have this number of beds, we have this number of this, but are we waiting to have our health workers get sick plus the public? Then we take them to isolation centers. Who will take care of them? So what we are saying is that the government, the technical people have failed the president. And we must say the way they are. There are many issues that goes into having a protected health workforce as well as the public. One of the things that is important because of a viral infection that may not have specific treatment is that somebody must be under good nutrition, good hygiene, wash hands. When you wash your clothes with the detergent that will remove the virus and kill them. But we have some of the health workers within the healthcare system who are being held in modern day slavery. They are being paid salaries like 20,000 shillings. There's contracts which we don't know where they're coming from. How do you expect this health worker to have proper nutrition so that his immune is not compromised, so that he cannot easily contract this contagious infection? So in terms of reaction at the technical level of ensuring that our healthcare providers are protected, I can say that the technical team that the government has put in place have failed the president. I authorized a course law today in Mbakadhi because it is now coming vividly that we have all the cases that have been confirmed in Kenya have gone through Mbakadhi. And yet in Mbakadhi there is not even one mask. There is no any protective counts. People are saying, yes, we have that facility, which is supposed to have been a maternity, that has now been turned into isolation hospital, a kind of isolation hospital in Kenya. But what are we doing about this watchman at the gate? What are we doing about the cleaners who are cleaning in the hospital? In Bakati, for example. What are we doing with that records officer? What are we doing with this person in the finance? About the nurse, about the doctor, about the clinician? Nothing is happening. And we are saying that we want to have those protective cares given to health workers, especially those who are at the first line to meet the patient as they come out. The casualty outpatient department, at the gate point of entry. And I thank Kenyatta National Hospital, the measure they have taken. For example, they are now limiting the number of people that can go to the hospital. They are even limiting the entrance to the hospital. And I want to thank that they should continue like that, because when you have so many points of entry to the hospital, then people might sneak in and actually bring the virus to the patient and to the colleagues and everybody else. I also want to thank the steps that have been taken by Honorable Wycliffe Ambetho Paranya. What he has done today is welcome, but we want to tell him that we need him to communicate to Council of Governors that let those health workers, especially those who are at the forefront, those who are in casualty, those who are in outpatient, and those who are in antenatal clinics, let them be provided with this protective care, especially the N95 masks. At that point, I can say none of the health workers in Kenya is currently protected.
Okay, so Dr. James Nyikal, I mean, it's not just the case of what's happening in Nairobi. Across the 47 counties, we're set to have isolation centers set up. There are issues with Magathi, as we've seen today with the go-slow. Take us through what exactly needs to be done across the country in terms of the medical personnel, the staff as well. Do we have adequate staff to actually counter this particular scourge?
Well, remember I said earlier that when you are talking of preparedness, you must talk of human resource, that is the staff. You must talk of facilities. You must talk of equipment. You must talk of drugs that are needed. Now, we're just talking of the human resource. And personal protective gear is a must. We cannot stop people from coming into Kenya because they'll infect us, and yet we leave health workers to go and handle those people without protection. So that's part of the preparedness that was required in numbers of things that were required. But now you ask what should happen across the country. We have, I know by now, a national pandemic preparedness and response plan. That plan should actually be cascaded down to the counties. And this actually should provide us with an opportunity to work in a devolved system where what is required in terms of standards is decided at the national level, and then this is applied at every level down to the counties. On all the facilities you are talking about, level 5, level 4, level 3, all down to the community, so that you have a clear plan of what is happening at the county is known and is the same across the country as what is happening at the national referral level. The resources that are required are known at the national level for the whole country and are known at county level and are known at sub-county level. So it is that structure that we must now put in place. I think it's an opportunity we can't miss. And when we are talking of, say, preparedness now, what we really seem to be doing very well is in preparing to stop the disease from spreading, which is extremely important. But I still find there's a gap in preparing at all levels on what to do if people are already affected. Look at the issue of testing that we are talking about. I'm happy that we have the capacity to do the testing, but there's one gap that is worrying me. We tell people that when you have these symptoms, they have actually done what is called a case definition. If you have the following, that you can call, but not all people will call, and we need education for that. What about people who appear at any health facility? It may be a private clinic, it may be a small dispensary, and that is where people may first appear. And if they have signs and symptoms that can fit what COVID-19 is, do we have Are we prepared? Are the staff educated enough to know these symptoms? I need to advise this person to go further. Because there may be cases within the country now that actually we have not picked that are spreading from person to person, and not just in relation to people who have traveled from known areas. That one, I think we need to really come out. And a little early on in the program, I saw that Dr. Luga was saying there was a meeting today at 4 trying to work out guidelines for that kind of thing.
Yeah.
I think that is probably a bit late, but we must do it immediately so that every health worker at any level, whether in the private sector, whether in public, meets a person who has symptoms that can relate to this, knows exactly what to do. The other thing we need to do at every level, when we talk of facilities, there are places where you actually quarantine people. There are places where you actually isolate people as you treat them. But we are at the very early phase of this pandemic, or at least the part in Kenya. It's actually on the upward trend. We may going to get to a place where we need to actually treat people who are severely ill. Are our hospitals equipped? Do we have support for respiratories, the breathing subsystems, the machines that we need? We don't wait until those are there. Now, I was looking at the ICU facilities that are available. The numbers of the beds may be there. Are there enough personnel to go with them? Are there enough equipment to go with them? Countries like the US or Italy are actually getting distressed now. What about us? What will save us is very early preparation, big time on prevention as we are doing, but whatever little we have is well prepared at every level.
All right. Now, Seth Panyako, as we conclude, early on we had an instance where the NHIF seems to be withdrawing insurance for healthcare workers. Perhaps, as we talk about this, kindly highlight the number of nurses, apparently, who have undergone training, if you have any of that statistic.
I don't have the statistics, but what I know is that about 1,200 healthcare workers have been trained. According to me, I may differ a little bit with my colleagues in terms of awareness. I have every reason to believe that every health worker in this country has awareness, because we have basically been trained on how to handle contagious infection, and I don't think there's a big deal about that. What we need is the specification on different pandemics as they come for us. For example, COVID-19. There are certain specific protective care that we need to have. For example, masks, N95, gowns, hand washing. And the issue of hand washing, personal hygiene, nutrition, those are the issues that all health workers know in this country. What we are talking about is the protection to these workers who are giving the services to the people who are coming in as sick, as Dr. has said. Now, when you look at the action taken by NHIF this morning, you can easily say that that is supporting to the president. You cannot wait when you have a pandemic like Corona is, and then you say that you are now terminating a contract to give healthcare insurance to healthcare workers. And we are now saying, now nurses and other health workers today are worried about when their children fall sick, or their dependents or the couples fall sick, and they depend on the NHIF comprehensive medical scheme. Now they don't have that medical scheme. They have now to think about where will we get the money now to go to hospital. I think this is not something that you need to go to court the way Oluga has said.
All right.
We want the president to give an executive directive, an executive order that NHIF should reverse what they have done until we are done with this coronavirus thing, because this money came from our payslip. The medical allowance was taken from the payslip of the health workers. Somebody cannot just wake up one day and say, now I took this money, I'm not giving you services today. I think that is one way of sabotaging the effort that are being put in by the national government and the president himself. So we are saying that NHIF must reverse that. We don't need to go to court over that one. And I'm requesting the president to issue an executive order for NHIF to make a revision on on the announcement they made today.
Now, Dr. James Nyikal, as we conclude, I mean, we've seen various countries and various bodies actually come together to fight this scourge. World Bank committing a certain sum of money, $60 million, to help respond to this COVID-19. Looking forward and the situation we have in Kenya, what exactly do you foresee in terms of the response as we have responded so far? What exactly do you see in the next couple of months?
Yeah, let me first of all say something about the insurance.
Briefly, yes.
When we have a national pandemic preparedness and response plan, we expect people from every sector, the financial sector, the security sector, the agriculture sector, the transport sector, the health sector, to be in that plan, in that team, so that we are planning a part like NHIF should not suddenly, what I find here is the problem, they were not aware of what it will mean. But if they were well represented, or at least the ministry, or somebody from the insurance industry was there, then they would weigh all issues that we have been dealing with and planning to act on, we put on hold. You can't implement them now. For me, I'm beginning to question whether it's everybody in there. In terms of the direction we are going, I had earlier said, this is the early phase of the pandemic, at least the part in Kenya. We are just starting to see the numbers rising. We had 1, we had 3, we suspect this. So it is actually going to go up. So all our systems, as I said, the prevention, I think those we don't want to go into, hand washing, movement of people, people getting into groups, not being close to others, those are okay, but we also must start saying, as the numbers get larger, where are the requirements? What will they be? What are the financial implications of this? Definitely, we may even have to go to Parliament to see if we need an act. We had an act on disaster, a bill on disaster that was discussed, went to Senators not. When we have declared this a disaster, is there a law which tells us exactly to do one by one by one? So that everything must now move in tandem with things as we are seeing, and it must be anticipatory.
Okay.
What is likely to happen next? After we have closed the schools,
All right.
the churches, the bars, what next?
Okay.
The hospitals, the human resource, the supplies, we must be ahead.
All right, so we definitely have to plan ahead, and thank you so much. That's Dr. James Nyikal, the Member of Parliament for Seme, and also seats in the Health Committee in the National Assembly. Thank you for your time, as well as Seth Panyako, who is the Secretary General of the Kenya National Union of Nurses. We do appreciate your input on the big story, as well as Oma Oluga, who talked to a lead reporter, Sophia Wanuna, earlier on during the show. So there's no need for mass hysteria and panic. Just make sure you're well informed and definitely maintain good standards of hygiene. My name is Jesse Rogers. Good evening.